Did you know that according to the American Cancer Society, over 1.9 million new cancer cases are expected in the US alone for 2024? What if a seemingly minor change in your body is actually a hidden warning sign? Early detection of cancer can significantly improve your treatment options and chances of a successful outcome. Today, we'll explore 8 early cancer signs you shouldn't ignore. Sign number 1, unexplained weight loss or gain. Let's talk about weight. We all know our weight fluctuates sometimes. Maybe it's because of a change in diet, exercise routine, or even stress. But what if the change is significant, like losing or gaining 10 pounds or more, and you haven't made any major lifestyle changes? That's when it's important to pay attention. Cancer cells can actually use energy differently than healthy cells, which can lead to unexpected weight loss. On the other hand, some cancers can cause weight gain by affecting your metabolism or hormone levels. The bottom line? Unexplained weight loss or gain shouldn't be ignored. It's always best to get checked out by your doctor to rule out any underlying conditions. Sign number 2, fatigue that won't quit. We've all been there, dragging through the day after a long week or a restless night. But what if that exhaustion never seems to go away? If you're constantly feeling wiped out, even after getting a good night's sleep, it's worth mentioning to your doctor. Cancer can drain your energy in a few ways. It might be using up nutrients your body needs to function, or it could be causing inflammation throughout your system. Remember, fatigue can have many causes, but persistent tiredness shouldn't be ignored. Schedule a doctor's visit to rule out any underlying conditions and get back to feeling your best. Sign number 3, lumps or bumps that weren't there before. This one's pretty straightforward. If you find a lump or bump anywhere on your body that wasn't there before, schedule a doctor's appointment. Not all lumps are cancerous, but it's always best to get them checked out. Lumps can appear in various parts of your body, including your neck, armpits, chest, abdomen, groin, or limbs. They might be painless or tender, hard or soft. Some common non-cancerous lumps include cysts, lipomas, fatty lumps, and swollen lymph nodes, which can occur due to infections. However, certain characteristics can make a lump more concerning. If a lump grows rapidly, feels hard and immovable, or is accompanied by other symptoms like unexplained weight loss, fever, night sweats, or fatigue, it could be a sign of a more serious condition, such as cancer. Breast lumps, in particular, should be monitored closely. While many breast lumps are benign, some can indicate breast cancer. It's essential to perform regular self-exams and report any changes to your doctor. Sign number 4, persistent changes in skin. Keep an eye on your skin. New moles, changes in existing ones, or any sores that don't heal could be signs of trouble. Melanoma, a type of skin cancer, often shows up as a new or changing mole. Melanoma can develop anywhere on your body, but it is most commonly found in areas exposed to the sun, such as the back, legs, arms, and face. However, it can also appear in areas that rarely see sunlight, including the soles of the feet, palms, and under fingernails or toenails. It's important to regularly check your skin for any new moles or changes to existing ones. Use the ABCDE rule to help identify potential melanomas. Asymmetry, one half of the mole doesn't match the other half. Border, the edges are irregular, ragged, notched, or blurred. Color, the color is not uniform and may include shades of brown or black, or sometimes patches of pink, red, white, or blue. Diameter, the mole is larger than 6 mm across, about the size of a pencil eraser, although melanomas can sometimes be smaller. Evolving, the mole is changing in size, shape, or color. Other warning signs include a sore that doesn't heal, redness or a new swelling beyond the border of a mole, itchiness, tenderness, or pain in the area. Changes in the surface of a mole, such as scaliness, oozing, bleeding, or the appearance of a lump or bump. If you notice any of these changes, it's important to see a doctor as soon as possible. Early detection of melanoma can significantly increase the chances of successful treatment. Sign number 5, unusual bleeding or discharge. Pay close attention to any unusual bleeding or discharge from your body. This can be a significant warning sign. For women, unexpected vaginal bleeding between periods, after menopause, or after sexual intercourse could indicate a problem. This type of bleeding isn't normal and should be checked by a doctor. It can be a sign of cancers such as cervical, uterine, or vaginal cancer. Blood in your stool or urine is another red flag. If you notice blood when you go to the bathroom, whether it's bright red or a darker, tar-like color, see your doctor right away. This could be a sign of colorectal or bladder cancer. Abnormal discharge from any part of the body should also be taken seriously. For example, a persistent discharge from the nipples can be a sign of breast cancer, while unusual discharge from the genital area could point to reproductive cancers. Cancer can disrupt normal bleeding patterns and cause abnormal discharge due to the tumors growing and affecting nearby tissues. Always consult a healthcare provider if you notice any unusual bleeding or discharge, as early detection is crucial. Sign number 6, difficulty swallowing or persistent indigestion. If you often feel like food gets stuck in your throat or chest when you eat, or if you have ongoing heartburn and indigestion, don't ignore it. These symptoms can sometimes be signs of cancer in the esophagus, stomach, or throat. Difficulty swallowing, also known as dysphagia, can make eating and drinking uncomfortable or even painful. You might notice that you choke on food or liquids more frequently, or that you need to chew food longer before swallowing. Persistent indigestion, or chronic heartburn, might feel like a burning sensation in your chest or upper abdomen. You could also experience a sour taste in your mouth or have frequent burping. These symptoms can be caused by other conditions like acid reflux or GERD, gastroesophageal reflux disease, but it's important to see a doctor if they persist. Early detection is crucial for treating any potential cancers effectively. If you notice these symptoms, keep track of how often they occur and how severe they are. Sharing this information with your healthcare provider can help them determine the cause and the best course of action. Sign number 7, chronic cough or hoarseness. A persistent cough that doesn't go away, or a voice that's been hoarse for weeks, could be a sign of lung cancer. Persistent cough. If you have a cough that lasts for more than 3 weeks, it's important to see a doctor. A persistent cough can be dry or produce mucus and may be accompanied by chest pain, shortness of breath, or wheezing. Hoarseness, a change in your voice, especially if it becomes more hoarse or raspy, can also be a symptom. This hoarseness can be caused by tumors pressing on the nerves that control the vocal cords. Other symptoms, along with a persistent cough and hoarseness, be alert to other symptoms like coughing up blood, unexplained weight loss, or fatigue. These signs can help in the early detection of lung cancer, which is crucial for better treatment outcomes. Sign number 8, changes in bowel or bladder habits. Pay attention to your bathroom routine. Changes in bowel habits, like diarrhea, constipation, or blood in your stool, shouldn't be ignored. The same goes for changes in urination, like urgency, frequency, or difficulty passing urine. Bowel habits, notice any significant changes in your normal bowel movements. This includes diarrhea, frequent, loose, or watery stools can be a sign of a problem. Constipation, difficulty passing stool, or having fewer bowel movements than usual can also indicate an issue. Blood in stool, seeing blood, whether it's bright red or darker, should be taken seriously and checked by a doctor as it could be a sign of colon cancer. Bladder habits, be aware of any unusual changes in your urination patterns. This includes urgency. A sudden, strong need to urinate could indicate a problem. Frequency, needing to urinate more often than usual, especially at night. Difficulty urinating, straining to urinate, a weak stream, or feeling that your bladder isn't fully emptying can be signs of bladder cancer or other urinary tract issues. Other symptoms, also watch for unexplained pain during urination, lower back pain, or pelvic pain. These could be additional signs of an underlying condition that needs medical attention. Important disclaimer. Now, remember, this video is for informational purposes only. These signs can be caused by many things, not just cancer. If you experience any of these symptoms, please don't panic. The most important step is to schedule an appointment with your doctor to get checked out. Early detection is key in the fight against cancer. By being informed and paying attention to your body's signals, you can take charge of your health. If you found this video helpful, be sure to like and subscribe for more health and wellness content. And remember, stay informed, stay healthy, and stay awesome.